Okay, let's talk about first time sex. It's a topic that's just swimming in confusing information, isn't it? From what you see in movies to all the myths you hear from friends, it can be really hard to know what's real. So, in this explainer, we're going to cut right through all that noise and give you a clear, evidence based guide to what you can actually expect. And this quote, it just nails it. There's so much cultural pressure built up around this one experience. We're often sold this single perfect story, but you know what? The reality is usually a mix of awkward, curious, and tender feelings, and that is completely and totally okay. So let's just push all of that cultural noise to the side for a minute. We're going to break down the real deal, the physiological and the psychological reality of the experience, all based on what we know from a clinical perspective. First things first, we have to talk about what normal even means here. The truth is, there's a huge, wide spectrum of what's considered a normal experience. It's so important to understand what your body might actually go through beyond the Hollywood version. Now, this might seem like a complicated term, biopsychosocial, but what it really means is pretty simple. It's just a way of saying that your body, your brain, your emotions, and even your environment, they're all connected. They all team up to shape how sex actually feels for you. So here's what that connection can look like in real time. Physically, you might notice things like increased blood flow, your body producing its own natural lubrication, maybe a faster heartbeat. And emotionally, the range is just as wide. You could feel anything from excitement to vulnerability. And let's talk about that last point, because it's a big one. Orgasm may or may not happen. Both of those outcomes are completely normal, especially the first time. Okay, this is so crucial. It's all about knowing the difference between what's common and what's a sign to maybe stop and check in. Feeling a little awkward or needing to pause? Totally normal. But feeling pressured or unsafe or feeling a sharp, burning pain, that's your body talking to you, and it deserves attention. And that brings us right to the elephant in the room. The most common fear people have about first-time sex: pain. So many people worry that it's just gonna hurt. So let's get into the why, the physiology of why that can sometimes happen, and more importantly, why it absolutely doesn't have to. So, the big question, will it always hurt? The direct answer is no, absolutely not. Pain is not a guarantee. Things like how aroused you are, how relaxed you feel, and your emotional safety all play a huge part. And honestly, a lot of people don't experience any pain at all. And this right here is the key. For most people, when there is pain, the number one reason isn't about your anatomy or being too tight. It's actually about an involuntary tightening of your pelvic floor muscles. And that's usually triggered by anxiety or fear. It's a physiological response, not a personal flaw. And the best part? It's something you can work with. I really want to pause on this for a second because this might be the single most important thing you hear today. If you feel pain, and I mean sharp, burning, or worsening pain, your body is sending you a clear signal to stop. This is not a test of your endurance. Listening to your body is absolutely vital. Okay, so now that we know all of this, how can we go from just understanding the experience to actually preparing for it? Let's build a toolkit, some really practical, actionable things you can do to feel more comfortable and more in control. Here we go. Step one is all about softening those pelvic floor muscles with some gentle breathing or relaxation poses. Step two, lubricant is your friend. Use it generously, it reduces friction. Step three is about taking your time with arousal. Touch, kissing, all of it helps get your nervous system ready for pleasure. Step four is about being in control. Picking positions where you manage the depth and pace can make you feel so much safer. And finally, step five, think about starting small, maybe with a finger or a slim toy, just to help your body get used to the sensation. See, each step puts you in the driver's seat. All right, let's wrap this up by talking about the most important element of all, your story and your timeline. Because this is all about consent, emotional readiness, and just remembering that this experience is uniquely yours. And this right here is the bottom line. Being emotionally ready is every bit as important as being physically ready. You are always, always in control of your own timeline. Remember, sex is a huge category of experiences, not just penetration, and you get to decide what your sex life looks like, completely on your own terms. Look, first-time sex doesn't need to be this scary, fear-based thing. When you have good information and you treat yourself with some compassion, you can approach it with confidence and curiosity. And hey, if you do find that discomfort or anxiety sticks around, please know that help is available. Your experience absolutely deserves care and support. And if you feel like some professional, evidence-based support, could be helpful, reaching out to a pelvic health specialist is a really empowering step. Getting that kind of individualized care can make all the difference. You should never, ever hesitate to advocate for your own comfort and your own health.